Greetings from Health and Beyond. Welcome to our next podcast on the Golden Hour reality, road traffic accidents or RTA, and triage in the emergency room in India. I'm Dr. Shanta Misra, a health communication and wellness expert, and your host for today's session. Today, we are tackling a critical topic that affects every community in India: road traffic accidents and emergency care. With India having some of the highest rates of road traffic fatalities globally, understanding the journey of a trauma victim from the roadside to the recovery room is absolutely vital. As per the Ministry of Road Transport and Highways Report 2023, there were 4,80,000 reported accidents with 1,70,000 related deaths. We often hear about the golden hour, but what does it really take to save a life in a bustling, high pressure Indian emergency department? To discuss this further, we have today Dr. Sandeep Jain, the Director and Head, Institute of Emergency Medicine and Trauma Care at Yashoda Medicity, Indirapuram, Ghaziabad, a graduate from Maulana Azad Medical College, New Delhi, and a postgraduate in surgery from Dr. RML Hospital, Delhi. Dr. Sandeep holds a fellowship in trauma care from National Board of Examination, New Delhi. He has more than 25 years of experience in managing trauma victims at major tertiary care hospitals of the country. He is a recognized postgraduate teacher for emergency medicine and an international faculty for basic life support, advanced cardiac life support, and advanced trauma life support courses. Namaskar. Welcome to our show, Dr. Sandeep Jain.
Namaskar, thank you so much.
So, our first question to you is, what exactly is the golden hour of trauma care, and what should the community do to support this golden hour in case of a road accident?
Yeah. So, ma'am, trauma is a time sensitive issue. The more the time is wasted after the management, after the injury, the more the chances that the patient will not live is there. So, golden hour reflects to that critical 60 minutes period after the injury when any medical intervention can be done to save the life of the patient. So, it's not exactly 60 minutes, it only says that as early as possible, we should get the medical treatment available. And this is the only thing which has shown to save lives. So golden hour is very important. And as you know, in India, the kind of traffic which we have and the kind of system which we have, it is
Yes.
not possible for the medical help to reach everywhere within 60 minutes. So it is important for the community also to know about this part, that as early as possible the patient should be reaching to a nearest medical center. So I would request the community to come forward, take that patient who is suffering from victim of a road traffic accident or any other kind of injuries to the nearest hospitals, and in the hospitals the doctors are there who can manage the patient initial part and to see that the patient's life is saved before any further definitive things can be done. So it is very important for the public to understand that they should not be afraid of taking the patients to the hospital. As we have seen many of the videos which are coming up on social
Yes.
media and all. Whenever the accident happens, people start taking the selfies or taking the
Yes,
videos.
yes.
So
True,
I
true.
believe that rather than taking those videos, they should come forward and take the patient to the hospital. If they themselves are worried, they should know the number of the nearest ambulance service which can be brought in and the patient can be given the medical care. So that first critical 1 hour in which the patient should get the treatment is very, very important, and this should be known to each and everyone.
So we have personal protection, and that's how we all take personal protection, like using seat belts, helmets, driving within speed limits, and we have safe driving practices which are mandatory. And people are repeatedly made aware of this. Fines are imposed, and we have policemen, we have traffic police. In spite of this, we have many injuries and fatalities. So, what are some of the most common life-threatening injuries you see from road traffic accidents? And are there any specific injury patterns you see more in India, like all these helmet, seatbelt, non-use related injuries?
Yeah, well, I think you have picked up a very pertinent point. The government is saying that there are so many regulations which are there. but unfortunately we are seeing a large number of victims. So if we look at the data which is available to us, the latest data is from National Crime Records Bureau 2023, and this is
Yes.
only the data which is reported. Unreported data is not
Yes.
there. So if
True.
we look at that data, every year, that 23 itself, there were more than 4.85 lakhs accidents which happened in India, and out of which almost 1.75 people lost their lives.
Yes.
So if we translate into time period, we will see that there is one accident happening every minute and one death is happening every 3 minutes. So that's a huge burden. And if
Yes.
you look at these trauma victims, majority of them are in the younger age group, between 15 to 45 years of age group, and we know that these are usually the breadwinners of the family. So what I
Yes.
believe and what people in the trauma vicinity, trauma fraternity knows that whenever the person dies because of trauma, it is not only a one death, it is a death of a family because there might be a lot of dependents. So people have to understand that all these regulations which have been made, all the rules which have been made are for their safety. Unfortunately, people use these rules when there are policemen are to avoid fines, not to protect their lives.
True. True.
And if you look at the vehicles, mostly the two wheelers and the pedestrians who get hit by these injuries, so they
True.
don't wear the helmets at all. And if even in
Yes.
Delhi, kind of thing where helmet is mandatory, the pillion rider, the person sitting behind, never wears the helmet. And
Yes.
especially for the females, they are
They
not
don't.
wearing the helmets. So, Dr. Misra, who was a former director of AIMS Trauma Center, he used to quote very famously that when the females don't wear the helmet sitting behind, it is for the protection of the brain. So, why don't the females also believe that they also have a brain? So, they have to protect it. So it is
True. True. True
important
that.
to
True
follow
that.
these rules. Now, in spite of all these things, when they are still the injuries are happening. And whenever the injury happens, it depends on what kind of injuries happen. So as I told that it's mostly the two-wheelers and the pedestrians who are getting hit by these vehicles and getting injured. So we see some kind of injuries, very life-threatening injuries which can be saved.
I was always thinking that once they wear a helmet, do they actually get a head-related injury or it's
Yeah.
less?
So very good point, ma'am. Because the helmet which they use
Yeah.
depends on whether they are using number one. If they are using,
The
then
belt
are they
should be.
using it appropriately or not?
Yes.
Many a
Yes.
times we have
Yes.
seen that they have not tied it properly, or the quality
Okay.
of the helmet is not very good. So if
Okay.
they are
Okay.
not using properly, normally we should have a full covered helmet which has got a visor and there's a facial guard also.
So
That
does
protects
that
against
save,
it.
if a good helmet, does it save lives? I mean, does
Yes,
it,
absolutely.
the injury is less?
Yes, the head injuries are less because whatever data is available in India and abroad, the majority of the head injuries happen because of non-use of helmets. So wherever
Okay.
the helmets are in use, the number of head injuries are less. So
Less.
your chances of surviving an accident is much higher if you are using a good quality helmet and using it appropriately, not only for the fear of the policeman but for your own brain. Okay. Yeah.
So RTAs, we have these road traffic accidents which also result in mass casualties. So how do you rapidly triage and manage a sudden influx of multiple severely injured patients in your busy emergency department? This is actually the topic, how we manage the emergency
Yeah.
department.
Yeah. So right now there's a lot of emphasis on developing the emergency and trauma departments.
Yes, yes,
If you look at the government regulations also, they are planning to open up different trauma centers across the highways, and they are saying that there should be one trauma center every 100 kilometers.
okay,
So what a trauma center means is it's kind of a hospital where the infrastructure is available, where the manpower is available, and the processes are available.
yes,
So you never know where the accident can happen.
yes,
Even in the smallest of the villages, you can get the accidents. We are
yeah,
hearing the stories like in Uttarakhand or maybe in Uttar Pradesh,
yes,
where there are accidents happening and there is no hospital nearby up to 200 kilometers. So
okay,
every hospital has to prepare. So, like
mhm,
if you look at our hospital in Yashoda, Medicity, we have got an emergency department which is fully equipped. So, we need to have all kinds of life-saving equipments and the drugs. Moreover, what we do is preparedness because, as we say, well begun is half done. So we need to prepare it. We need to be
yes,
ready that in case a mass casualty happens, the number of the patient comes, how we are going to deal with it, which we normally don't do it on a daily basis. So this is
yes,
called as a disaster planning. So every
yes,
hospital needs to have a disaster plan for themselves. Even the NABH also mandates it that you should have a disaster plan. And this disaster plan is not fixed for any hospital. It's not like a blanket things. You have to use your own resources, whatever is available to you, what kind
yes,
of injuries you are expecting. Based on that, you have to do it. So when we prepare for ourselves, we define what kind of engines will be getting, what equipment will be required, who will be the people who are managing different kinds of injuries. So, like we have three different kinds of injuries. We triage them based on their criticality. So their simple triaging and rapid treatment scheme, which we say depends on the patient, what is the respiratory rate, what is the patient's sensorium, and what is the patient's capillary circulation. So we divide them into whether it is a red category, yellow category, or green. Red means these are very critical patients who require immediate intervention, otherwise they will die. The yellow categories are those who got some serious injuries, but they will have some time before the medication can be given to them. And the greens are usually which can be managed by anyone who has got some kind of knowledge, a stable kind of injuries. So this kind of categorization helps us in knowing which patient needs our immediate care. So we divide our areas in the emergency department or the trauma centers into different zones. We call it red zone, green zone, yellow zone. So the moment the patient comes, there's a trained staff who looks at the patients and decides which category the patient belongs to, and appropriately the patient disposed of to that area. And in that area, there are the specialists available depending on their expertise and their skills, and then they manage the patient. So if I
So
give
is
you an
there
example,
any situation which you have in mind, any exemplary situation which you and your team managed in emergency care which comes to mind?
yeah, I
Any,
distinctly
any?
remember there are two separate incidents. One was a accident which happened right in front of our hospital. There were the two young boys who were riding a bike, and they stood at the red light because there was a red light. And unfortunately, the bus which was coming from the behind did not follow the traffic rules and they rammed them over. One child died there. The second patient came there, and that young boy was bleeding from everywhere. And luckily, because we have a trained team, so this trained team managed the patient, and we could get that patient healthy and send him home after 3 months of the hospital stay. So that shows that if we have a trained staff, our processes are in place, then we can save a life. The another incident which we have seen was a patient, the family which was traveling in a car early morning in the winters around 4 o'clock. They met with the accident in the highways. One person died there. Four people were brought to the hospital, and out of this, three people were very critical. Again, the team, because of their training in trauma management, because of our processes and the equipment available to us, we were able to save the lives of those patients. So what we believe is that our team needs to be trained because a lot of training courses available like advanced trauma life support for the doctors, then advanced trauma care for the nurses, then there are pre-hospital care courses are available for the general public and the paramedics. So what we do in our emergencies, whenever we are sitting idle, when we don't have too many patients, we take this an opportunity to do some kind of a simulation exercises, and this exercise helps us to prepare better. So the more
Mhm.
we prepare, the more we do our repetitions, the better the team becomes. So
So
it
you
gives
feel that hospitals should have these kind of mock drills when,
absolutely,
especially if a
absolutely,
large number of influx come, a large number of
absolutely.
patients that
Ma'am,
require.
there is no doubt about it. If you have to give the life to the patient, everyone has to pitch in. And for them to be pitching in the right moment when the things are becoming very aggressive and the lot of attendants are there, injuries are there, you should not be panicky. And you don't panic only when you practice beforehand.
Yes, yes, true, true that. So, are you seeing any practical application of technology like telemedicine, AI for diagnostics, or better communication apps? Are these meaningfully improving emergency care in road traffic accidents? And what is the practice on training and continuing medical education on emergency care?
Even this is a time which has come with technology, and we
Yes,
can't deny the fact that technology and AI going to come in. It is going to help
yes,
doctors and paramedics in
absolutely.
giving a best care to the patients. So, if I
Okay.
look at the current technologies which are happening, we are looking at different aspects, whether it's out of the hospital or within the hospitals. So, if I talk of pre-hospital care, this technology has helped us in getting connected to the ambulance services.
Oh,
So
yes,
whenever the patient has a problem, he can just dial from everyone has got a mobile now. So if
yes,
every person in the country saves one ambulance number or the emergency care number,
yes,
in India right now we have a universal healthcare access number that is 112. So any person from anywhere in the country can press that number and the nearest ambulance will come there. Nowadays, the ambulance is getting upgraded with the GPS enabled
GPS.
and 5Gs. So we can
Okay.
track the location and reach there to provide the treatment early.
That's
Now,
very good.
so for the
So
trauma
even
medicine,
even the victim can just take out his and just press it,
yes, yes,
and the
absolutely.
emergency.
It's like
Okay.
an emergency contact, a panic
Okay.
button. So you should have that number saved in your mobiles so that you can call the nearest ambulances. So
Okay.
even if the ambulances reaches, now the good ambulances which are the facilities which are getting developed with the help of technology, we have the patient inside the ambulance and all the data patient, all the vitals like heart rate, blood pressure, oxygen, they get transmitted to the hospital. And we
So
can
they are
give the
prepared.
direction, yes, to the ambulance while the ambulance is en route, and we
Okay.
can give directions to the people sitting in the ambulance what to provide. So
Okay.
this helps us a lot in
So
giving
this
the
is
primary care.
okay.
So this technology is really helping us in giving access of ambulance services to the patient, as well as allowing us as a doctors to give directions to the people sitting in the ambulances to provide the best of the care. And this data which comes through us also helps our hospital to prepare better because we know which patient is coming and what does he need. So it helps
Does
us
it
in the
even show
preparedness.
blood group, and or does it show? I mean, do you come to know the blood group
No,
also? Or
blood group has to be tested. Right now, the
tested?
facility is not available. But
Uh-huh.
with the development of AI, there are tools which are getting developed now, which will take you like a single prick, just like you have blood sugar testing. You can test that and will tell you what your blood group is. So once that technology is getting available in the future, it will be very easy to know what is the blood group of the patient. We have all the information available to us and we get prepared better. Once the patient reaches to the hospital, we are able to provide the care which is required, and AI has come really helpful in diagnosing. You know, we have to do ultrasound, we have to do x-rays, we have to do blood test. All these can be automated and the results are available within minutes. And this helps us in making good clinical decisions to save the life of the patients. Now, I just came back from the National Trauma Conference held in Mumbai, and we came to know that new technology, AI, which has come up, is going to tell us with the help of an infrared spectrometer that what is happening to the patient's physiology, what is happening to the oxygen level, what is happening to the blood pressure, so that we can tailor make the patient's products accordingly. We have viscoelastic assays which can tell us exactly at what part of the clotting mechanism the problem is. So obviously once we get the data, we do a data analytics. All this will help us know what is our patient coming from, which areas they are coming, what kind of injuries are coming. So our operational planning also becomes much better. So really, like now, ECGs from the different smaller hospitals are also being transmitted with the reports on. And the best part of this care is we can give guidance through telemedicine to a smaller centers. They can start the initial treatment and they can contact us. Like if you talk about Yashoda Medicity, we have tied up with a district hospital in Ghaziabad. So wherever the patient reaches to them, we can see what is happening to the patient, what they are doing, and we can guide them into procedures also. So this helps the patient to get the right care for stabilization before the patient is shifted to the hospital. And this also helps in the communication between the two health centers so that the patient care is the transport is become smooth. And by the time the patient is there, the team is already ready. So
Yes.
all those really improve the patient care.
And what is the practice on training and continuing medical education on emergency care? All
So
those students who haven't studied yet.
yeah, absolutely. I think this is a need of the hour. If you know that National Medical Commission has made it mandatory for every medical graduate to undergo training in basic life support and advanced cardiac life support. The same thing is required for advanced trauma life support also for the doctors. So this thing, I think the society is talking with the government, and we hope that soon it becomes mandatory for every doctor before he graduates to get trained in basic trauma care. So these kind of courses are available for the doctors and the nurses. Now the society has also come up with a first responder program for trauma for the general public also. So we
Okay.
can train the general public to do the basic things at the site like controlling or putting a bandage, putting a splint, putting a kind of anything to for the fractures. So these
Yes.
things can help us in stabilizing the patients. Now, as I told beforehand also that we need to have the regular mock drills being done. So training is
Yes.
very important because mock drills are there. And
Yes.
then since science is evolving, so we encourage all our healthcare professionals to update themselves by regular CMEs and conferences. So this really helps us in providing the best of the care which is available to any patient. We talked about golden hour, but we
Yes.
receive patients who are coming 6 hours, 8 hours, 12 hours late. So we hope that once there's a penetration of this awareness, the penetration of the pre-hospital care, we can get the patient early and then maybe we can save a lot many lives.
So, our final question is that the government has strengthened the Good Samaritan law. And what will be your advice to the bystanders? We have talked about this, who witness any accident and want to help and bring RTA victims to the hospital.
So I think the Good Samaritan law, people have to understand that this is for the protection of the person who is helping a victim. They need not be worried about what will happen to them. As per the law which is applicable now across the country, all the states have to honor it. If you see a patient, you if you're working in a good faith to help this patient, you can take this patient to the nearest hospital, and no hospital can refuse the first aid and the life saving care to these victims. If the person who is taking that, the bystander who is taking the victim to the hospital does not want to divulge his details, no hospital, no police force can force them to give their details. If they are willing, that's fine. If they are not willing, they are not forced to divulge their details. And even if someone troubles them, they have a resource to the grievance committee where they can put their thing. All these are just to encourage people to help the trauma victims. So what government has done is they're also trying to incentivize and give the rewards. So any person who is helping their victims and getting the patient, he will also get some financial incentive. In addition to that, he will get some certificate to show that he is willing to help. So
Yes.
good Samaritan law means you are there to help rather than it is the community who is going to be the first responders. It is the people who in the nearby vicinity who are going to give that initial care which is required to save the life of the patient, and
Yes.
taking that people to the hospital in the golden hour, and then we as a healthcare professional can help them a lot. So I
So,
think
have you
people don't have
met
to worry.
have you met such good Samaritans?
Yes, yes, yes. Yeah, they are coming up. I hope that numbers will increase. But as of now, they're very far and few. So some people do bring in the bringing in the patients. Uh, we have also seen, especially in Delhi NCR area, that sometimes the people whose vehicle is getting involved in the accident, they themselves bring rather than running away, hit and
Okay.
run. They are getting the patient. So I think this
Okay.
awareness needs to be generated. Once we get this awareness generated, our most of the patients might be able to be saved. So
Okay.
I think people don't have to worry. My only request to everyone is please do not shy away, do not fear of anything. Get the patient to the hospital. You are doing a help to a fellow victims. You never know when this victim is going to be one of your family relatives in somewhere near future. So whatever we do, we might have to repay it back. So it's
Yes.
always good. Don't worry about yourself. No one is going to bother you.
So thank you, Dr. Sandeep, for your time and invaluable inputs on this very important topic. To our viewers, we hope this episode has given you a deeper appreciation for the work being done in an emergency department and how important it is to understand the golden hour in saving lives in a road accident. From safe driving, obeying traffic laws, and being a good Samaritan, it is a collective effort from all of us to support the work of Dr. Jain and all others managing emergency care. Thank you. Namaskar.
Thank you, ma'am. Namaskar. Thank you
Thank
so much.
thank you.